Okay, hi everyone. Thank you for coming out here today. My name is Jennifer Walsh. I'm a Senior Media Officer with the Institute of Medicine, and we're here to release our new report, Cognitive Aging, Progress in Understanding and Opportunities in Action. This report is now available, and you can download it for free at www.iom.edu/cognitive aging. And there's a lot of other materials available on that website as well. So this is going to be a 1-hour briefing unless we run out of questions beforehand, and we will be taking questions from those in the room as well as those via the web. But we're going to start off with some introductory remarks, and then I will open it up to questions. And with that, let me introduce Dr. Victor Zhao, President of the Institute of Medicine.
Thank you, Jennifer, and welcome to all of you. I think this is a phenomenal study. Really, really important on cognitive aging. So thank you so much for being here today. I want to start by thanking, in fact, some of our committee members who are here. First, Chair Dan Blazer, the J.P. Gibbons Professor Emeritus at Duke University, an old friend. And we worked together for over 10 years at Duke. Vice Chair Christine Yaffe from UCSF. And, of course, the committee member Marilyn Albert from Johns Hopkins. Thank you so much for being here. And thank you for your tremendous service to IOM, to our nation, particularly in working on this report. And of course, the work can be done without special thanks to staff who have just put in tremendous effort into development of this report. That's Andy Pope, who's back there, Kathy Liverman, Sarah Dominitz, Claire Gianmaria, Judy Estep, and Janet Geider. So for me, it's very exciting to see this report. I wanted to be here because I think this is so meaningful to all of us, the understanding of cognitive aging, progress in understanding, and opportunities for action. Well, we're all aging, right? And, you know, when most of us have been very closer than others, I certainly can identify with this, and we see ourselves changing in terms of physically, but also the minds. In many ways, aging and experiencing more of life, family and friends, it's exciting. Certainly as a new grandfather, I feel what a great opportunity seeing this young one now growing up and doing different things. But also, it makes us worry sometimes too. And you know, one line that stuck out in this report, at least for me, was, and I quote, people forget things. A name, where the keys are, a phone number. Now, what is dismissed as a minor inconvenience at age 25 years old, well, it can be a flashing concern at age 35. But when you reach my age, it's a major source of personal worry. What's happening to my mind? Am I getting Alzheimer's? So I think all of us can relate to this one way or the other. So we worry a lot when it comes to lapse in memory, what we call cognitive blips that cause us to jump to a conclusion about, boy, are we getting Alzheimer's or other diseases? The problem is that many of us really do not know that it's quite normal to have this. What is normal and what should be cause for worry? This report, I think, clarifies a lot of these issues, which I think is why it's so important. So, for example, the report knows that it's quite natural for the brain to age. Well, just like the rest of your body. It's a part of a biologic process. And what's more is cognitive aging is not a disease. I want to emphasize that. I think it's really important for people to understand this. It's not the same as Alzheimer's or other types of dementia. For example, Alzheimer's is characterized in part by extensive neuronal loss. And sadly, there's no effective way to treat this kind of problem. Cognitive aging, on the other hand, is a natural and happens to everyone. It affects us in all different ways. It doesn't involve extreme loss of neurons, but the function of individual neurons may decline. I always say to people when I can't remember the name, my synapse is a little slow. That neurotransmission is getting there, and I get it afterwards. Well, that to me is a reflection of the biologic process. This report also noted that, in fact, some cognitive functions improve with age. Certainly, we gain experience and more comprehensive knowledge, And believe it or not, older adults actually report greater levels of happiness than young people. That's a good one. I think we've all heard our population is aging, and the aging and the whole is growing much greater. And in 2009, there were 39.6 million people over 65 in U.S., and by 2030, it's estimated this number will rise to 72 million, more than twice the number of older people that were there in the year of 2000. So cognitive aging is something that we need to understand in more depth. And as much more percentage of our population will be experiencing this later stage of this process. Also, if we don't take measures to understand and deal with it, there can be consequences. For example, we know about the number of people aging and the problems that can be associated with it. Also, there's a whole phenomenon of financial abuse of the elderly. In year 2010 alone, the victims of financial elderly abuse lost $2.9 billion. So we need to deal with this as well. The good news is that there are things we can do to support other parts of the body as they age. And we can do that in the brain too. And much of it is straightforward. Exercise, active, don't smoke, get a lot of sleep. But it's time that we get these messages to the public, which is why I think this report is so important. For the public to be assured and to know the right things to do. And also, there's a need for more research, of course, in this area where it can make a difference. And also, there's a need for people to understand, families and friends, to understand this beyond individual level, to provide the support. Also, of course, there's federal, state agencies and industry, such as financial banking industry, transportation technology, others, that if they get this whole thing, we can all do so much better. So I think this report is an incredible base of evidence to start these conversations, to inspire actions from many stakeholders, to increase the likelihood that we stay in shape in our old age. I think one of the things we do so well at IOM is to call to attention these issues that are of public interest and public health implications, and to engage people in this conversation, to engage people to understand this better, to perform better, and of course support research that can help us advance the field. So with that, I'd like to thank the committee members and turn the podium over to Chair of the study, Dan Blazer, who's going to tell you more details of this study. Thank you.
Thank you, Victor, and thank all of you, both here in the room today and those of you who are on the webcast. We're very excited about this report because we feel like it really cuts to one of the most issues of most concern to older adults, cognitive aging, and we'll hopefully explain that more as we go along. These are members of the committee. I'm not going to read through this list. I did chair the committee, but also I have with me Christine Yaffe, a professor of psychiatry at the University of California, San Francisco, our vice chair, and she will be dividing this presentation with me. And along for support, and she's always more than support, Marilyn Albert, professor of neurology at Johns Hopkins University. Both of these are long-term friends. But I want to just make one comment about the committee, and that is this is a committee that worked very hard. Every single member worked, and we really had no difficulty in coming to a consensus about the message that we needed to get forward. Our sponsors, as you can see here, the McKnight Brain Research Foundation, the National Institute on Aging, the National Institute of Neurological Disorders and Stroke, the Center for Disease Control and Prevention, Retirement Research Foundation, and ARP. The point I want to make here is this is quite a range of sponsors, and I think it reflects the importance of this topic and the willingness of these sponsors to enable us to produce this report itself. Statement of task, I'm going to pass over this because actually I think that will become very clear as we go on with our report. And this is our timeline. We started in February of 2014, so we're just a little bit over a year from the time that we started, but we worked very hard during this time, and the report now is available. So the question comes up, what is cognitive aging? Well, cognition refers to the mental functions involved in attention, thinking, understanding, learning, remembering, solving problems, and making decisions. The important point here is that cognition is not just memory. Cognitive aging is a process of gradual, ongoing, yet highly variable changes in cognitive functioning that occur as people get older. 2 points here. The brain ages in all of us, but there's wide variability in the way the brain ages. Cognitive aging is a lifelong process. It's not a disease or a quantifiable level of function. As Dr. Zhao mentioned, the brain is plastic. It can recover to some extent from the changes that do occur with aging, and that's especially true with cognitive aging, for in cognitive aging we do not lose neurons like we do with Alzheimer's disease. In the context of aging, cognitive health is exemplified by an individual who maintains his or her optimal cognitive functioning with age, and we have some recommendations on how that can take place. Demographics, Dr. Zhao already went through. The important point here is that this is a major issue now. It's going to be even greater a major issue as we move on through the next few years of this century. Key features of cognitive aging, it's inherent in humans and animals as they age. Important point here is that animals show cognitive aging. They do not tend to show the changes that we see with neuropathological problems in late life, such as Alzheimer's disease. So this provides an opportunity for looking at animal models in order to explore this further. It occurs across the spectrum of individuals as they age, regardless of initial cognition. It makes no difference whether you have a PhD or only a high school education. It makes no difference if your IQ is 140 or 70. Everyone is, to some extent, subject to cognitive aging. It's a highly dynamic process with variability within and between individuals. I'll show you a slide in a moment to illustrate that. It includes cognitive domains that may not change, may decline, or may actually improve. And so memory, some decision making, reaction time, those tasks tend to decline as we get older. Wisdom, experience, vocabulary, those tasks or those domains tend to maintain themselves or may in some cases actually improve as we get older. We're only now beginning to understand biologically what cognitive aging is, but we have made some initial progress, and that's important to understand, and I think this area will continue to grow as we move on into the 21st century. It's not a clinically defined neurological or psychiatric disease such as Alzheimer's disease. We've already mentioned that. I'll show you this slide. The blue are individuals who are males, pinks are females. The important point is to look at the dark versus the light sections of these slides. The vast majority of people, at least under the age of 74, do not have Alzheimer's disease. They do not have mild cognitive impairment. But everyone in this light section, both pink and blue, are subject to cognitive aging. And so we're talking about a pretty wide group of individuals, millions and millions. First thing I want you to see on this slide, and this is looking at sort of an overall measure of cognitive function from about the age of 60 until around the age of 90. And you can see on average, looking at the red line, that there is a gradual decrease in cognitive function. But that's not the important message from this slide. The important message is that if you look at the dots and you look at the lines connecting the dots, these are individuals measured at multiple points in time. And you see they're going all over the place. And so sometimes people are going down, sometimes they're going up, sometimes they're flat. And so this represents, from this particular study, that cognitive aging actually is a highly variable process, as we mentioned before. Some key messages from our report include the following. Cognitive aging is more than decline in memory or speed processing. It can have positive effects on cognitive aging, on cognition, as we mentioned before. Scientific understanding of the non-disease characteristics of cognition with age is rapidly advancing, but we are in our infancy. There's much more to be learned about this. There's wide variability. We've already talked about that. Age affects all organs, including the brain, and that's important to recognize, and we just need to keep that in mind. So as individuals go in to talk to their doctors, they're not just talking about their kidneys or their heart or their bowel systems, they're talking about their brain as well, or there should be. Cognitive changes can affect daily activities, and Dr. Zhao mentioned some of those, and we can go into more of that in the discussion if you wish. actions can be taken by individuals. There is a message of hope in this report. It's not just inevitably things are going to get worse. There are things that can be done, and we need to recognize that now. It's not that we need to discover a new drug in the future. There are things that can be done now. Opportunities for action take place at many levels, and our recommendations, I think, will recognize those particular actions. So I'm going to go through a couple of recommendations, and then Dr. Yaffe is going to continue on with our recommendations after that. The first is a recommendation to increase research and tools for assessing cognitive aging and cognitive trajectories. I think every IOM report suggests more research, but I would really make a special plea here because this is a topic that is just early on in its development, and there are multiple opportunities to explore that research more. We're recommending that NIH, CDC, research foundations, academic research institutions, and the private sector should expand research on the trajectories of cognitive aging and improve the tools used to assess cognitive changes and its effects on daily function. Specific needs include studies using a wide range of assessments to explore the physiological and structural basis of cognitive aging, non-human animal studies that examine mechanisms and clinical correlates of cognitive aging, studies to examine the mechanisms underlying interventions that affect cognitive trajectories, studies to identify and validate novel tools and measure function, an update of the norms for cognitive function in older adults. Recommendation 2 is to collect and disseminate population-based data. We need a better background for understanding the burden of cognitive aging in our society to better understand the level of problems and levels of issues that we're dealing with. CDC, state health agencies, and other relevant government agencies, nonprofit organizations, research foundations, and academic research institutions to strengthen efforts to collect and disseminate population-based data on cognitive aging. These efforts should identify the nature and extent of cognitive aging throughout the population, including high-risk and undeserved populations, with the goal of informing the general public and improving relevant policies, programs, and services. Data collection and dissemination efforts should focus on cognitive health as separate from dementia and other diseases. Develop operational definitions of cognitive aging. Involve representative surveys involving diverse and high-risk populations. Emphasize longitudinal assessments and include cognition questions on the core of the SS rather. So I'm going to turn it over now to my colleague, Dr. Yaffe, who will continue with our recommendations.
Thank you, Dr. Blazer. So I'm going to continue now with recommendation number 3, which is, I think, really one of hope in that we can really do something about cognitive aging. We can all take action to reduce the risks of cognitive decline with aging. And this is true for individuals of all ages, recognizing that cognitive aging is across the lifespan, and their families should also take action to maintain and sustain their cognitive health, realizing, again, there's wide variability in cognitive health among individuals. So the specific recommendations we felt that had the best evidence are to be physically active, to reduce and manage cardiovascular disease risk factors such as hypertension, diabetes, and smoking, regularly discuss and review health conditions and medications that might influence cognitive health with a healthcare professional. Very important. Sometimes this isn't always paid attention to. And there are some other actions as well that may promote cognitive health listed in the report. Recommendation number 4. We felt that, as Dr. Blazer mentioned, there's a lot of opportunity for more research, in particular trying to understand more who's at risk and what we can do about preventing the cognitive decline. We recommend the NIH, CDC, and other relevant government agencies, nonprofit organizations, and research foundations should expand research on risk and protective factors associated with cognitive aging, and especially on interventions aimed at preventing or reducing cognitive decline and maintaining cognitive health. Some research opportunities include collaborative approaches between ongoing longitudinal studies, risk factors and interventions in understudied and vulnerable populations. We felt there wasn't a lot of good evidence. clinical trials specifically on interventions, and approaches to sustaining behavioral change that promote cognitive health, recognizing that it's hard to sometimes change behaviors. Recommendation number 5, to ensure the appropriate review, policies, and guidelines for products that affect cognitive function or assert claims regarding cognitive health. We recognize there are a lot of claims, and sometimes it's hard for individuals and families to know how to interpret some of these claims. So we recommend the Food and Drug Administration and Federal Trade Commission, in conjunction with other federal agencies and consumer organizations, should determine the appropriate regulatory review, policies, and guidelines, specifically for over-the-counter medications that may affect cognitive function and interventions that do not target a disease but may assert claims about cognitive enhancement or maintaining cognitive abilities, such as memory or attention. Recommendation number 6, to develop and implement core competencies and curricula in cognitive aging for healthcare professionals. The Department of Health and Human Services, Department of VA, and educational, professional, and interdisciplinary associations and organizations involved with the health care of older adults should develop and disseminate core competencies, curricula, and continuing educational opportunities, including for primary care providers that focus on cognitive aging as distinct from clinical syndromes such as dementia. Again, we feel there's a lot of opportunity for action and for education. Sometimes healthcare professionals don't realize some of the changes that are cognitive aging as distinct from dementia or clinical syndromes. Recommendation 7, to promote cognitive health in wellness and medical visits. Public health agencies, healthcare systems, CMS, health insurance companies, healthcare professionals, schools and organizations, healthcare professionals and individuals and their families should promote cognitive health at regular medical and wellness visits among people of all ages. And attention should especially be paid to thinking about cognitive outcomes during hospital stays and post-surgery, a particularly vulnerable time for cognitive outcomes. Specific responsibilities are there for healthcare professionals, for CMS, for healthcare systems and insurers, providers, patients, and families. So again, a real opportunity for action. There is a wellness visit in place. We felt that this could be embraced to pay greater attention to cognitive aging. Recommendation number 8, to develop consumer product evaluation criteria and an independent information gateway. The CDC, NIH, and the ACL, in conjunction with other health and consumer protection agencies, nonprofit organizations, and professional associations, should develop, test, and implement cognitive aging information resources and tools needed by individuals and families to improve informed decision-making regarding cognitive health. Specifically, a central, user-friendly website to provide independent evidence-based information and links relevant to cognitive aging, and consumer-relevant criteria should be developed and disseminated to provide guidance on evaluating cognition-related products, such as cognitive training products, nutraceuticals, and medications. Recommendation number 9, to expand services relevant to cognitive health. Relevant state and federal agencies, nonprofit, professional associations, and private sector companies and consumer organizations should develop, expand, implement, and evaluate programs and services used by older adults relevant to cognitive aging, with the goal of avoiding exploitation and optimizing independence. So these are the key messages. We want to be advocates so we avoid exploitation and maintain independence. And these are some specific actions relevant to the financial decision-making that was alluded to by Dr. Zhao, driving and transportation, technology, and health information. Our final recommendation, number 10, is to expand the public communication effort and promote key messages and actions. The CDC, ACL, NIH, and other federal agencies, state and local government agencies, and relevant nonprofit and advocacy organizations and foundations, professional societies, and professional and private sector companies should develop, evaluate, and communicate key evidence-based messages about cognitive aging through social marketing and media campaigns, something I think a lot of people don't know much about, but a real opportunity, again, to educate and to promote action. to work to ensure accurate news and storylines about cognitive aging through media relations, and to promote effective services related to cognitive health in order to increase the public understanding about cognitive aging and support actions that people can do to maintain their cognitive health. Some real key public health opportunities. We think that one of the exciting things about this report is there are opportunities for action at many different levels, certainly at the individuals and families, at communities, with healthcare professionals, public health, research funders and researchers, policy and regulations, and the private sector businesses, including financial, transportation, and technology industries. I'd like to conclude by thanking you and provide the link for the report that's just being released. There's some other materials as well on the website that include a lot of information, the brief report, action guides, and a quiz. And I think at this point we're ready for some questions, and we want to thank you all. Jennifer.
So yes, we'll open up to questions. So for those of you in the room, if you have a question, if you can please go to the microphone and identify yourselves and your organization. And for those who want to ask a question on the web, just scroll down below the video player and there's a box where you can type in your question. Anybody want to be the first one? Okay.
So Matthew Baumgart with the Alzheimer's Association. I have a couple of questions, but I'll ask one now and then come up again after others get a chance. Could you go into a little more detail explaining the difference between cognitive aging, which you have defined as normal, and cognitive decline? Could you go into a little more detail on that?
So, and I'll let my colleagues, Christine and Marilyn, help me out with this also, because I think this is absolutely a critical issue. There's no clear line that we can draw here, so I think it's important to recognize that. What we're trying to develop here is a construct which includes those individuals who do not show, from a pathological perspective, neuron death or significant neuron death. But in addition to that, we're talking about individuals who are concerned about their memory and other cognitive functions. They're individuals who are, I think, challenged with certain ADL responsibilities that may not actually reach the threshold by which we might call that person experiencing mild cognitive impairment or Alzheimer's disease. We're basically looking at this trajectory of individuals who are showing a decline over time. But I think it would be a mistake to suggest that we have developed or imagined right now that we can conceive of a very clear line along the way. So I'm going to let Marilyn and Christine answer this also.
I think part of the answer is what we've learned from looking at animals, because animals, as you probably know, don't develop neurodegenerative disorders such as Alzheimer's disease. And in animals, what you see is that with age, there is not a loss of nerve cells, but there are changes in the way the nerve cells function. And so then sometimes that means there are some changes in cognition. So there are declines in some areas in some people. There's an enormous amount of variability. And as Dan said, it's very, very hard in humans to draw the line between what degree of decline is what we would expect to be within the normal range and what is impairment. And that's one of the things that needs more study, that boundary between aging and diseases of the brain.
Yeah, exactly. I just wanted to follow up and remind us all that we're really talking about a continuum often, and that I think one of the exciting things about the cognitive field is how far we've come in understanding the continuum, but we still, I think, need to understand more at the early side, and that cognitive aging happens to all of us, but this is not in keeping with a clinical definition of a cognitive impairment syndrome.
Hi there, this is Sarah Locke from ARP. I wanted to thank you for an excellent report and incredibly useful information. And you referenced in your opening remarks a lifespan approach to cognitive aging. And I had the overall impression that it was never too late to make improvements in your cognitive health. And I was wondering if you might address that.
Yes, obviously the earlier the better to be engaged in some of the activities that we have recommended, but we do not feel that there's any age where you might not gain some benefit from some of the recommendations that we've made. So there is a lifespan perspective here, but that should not lead a person who's 75 who maybe is beginning to experience some of these problems, but it doesn't reach the threshold of a disease, to say there's nothing I can do, I'm inevitably going to develop a disease, and so I'm going to give up. We're saying there is evidence to suggest that exercise, really controlling your cardiovascular risk factors, really checking with your physicians about medications that you're taking to see if you're taking medications that need to be taken or not, and a series of other things. All of those are actions. I think we really are calling for individuals, their families, healthcare providers, and others to say, regardless of age, this is an issue that is of enough public health concern that we need to be thinking about it every step along the way. Our report focused mostly on older persons, but it's not simply limited to them.
And I would just emphasize the word that Dan used earlier, which is plasticity. So we believe that the older brain has an enormous amount of plasticity, which is to say that there's opportunity for growth and development and alterations in problems that might have existed. And the body of literature that we reviewed in this report supports the enormous opportunity for older people to take preventive action and to improve their cognition as they get older.
Jane Tilley from the Administration for Community Living. I'm wondering if you could talk a little bit about, several people have mentioned advantages to cognitive aging. So if you could elaborate a little bit more on that. I heard more about older people are happier, and there's a little bit, from what I understand, a little bit better information processing. Maybe I'm using the wrong words, but as you get older.
Well, a couple of things, and this is an area that, again, deserves more research, I think, because we've got some intuitive thoughts about it, but I think we really need more empirical data that can help us. But just to give you an example, older persons seem to gain more wisdom as they get older. And wisdom is sort of solving more complex problems that have somewhat ambiguous potential good solutions to them, and the ability to work through some of those issues. Given time, I think older persons can do a good job with that. So that would be one example. There actually are some empirical tests of wisdom that are out there that have been used, and I think that's probably a start in terms of trying to understand it. Vocabulary would be another area. If you're not suffering from a disease, vocabulary tends to be maintained and may even increase. And so if you're reading, if you're attending courses of one type or another, if you're doing crossword puzzles, I think all of those might be opportunities that you actually might see your vocabulary increase with aging. So there would at least be a couple of areas where we see. And I think, sort of getting back to the wisdom side, there's certainly something to be said for cumulative wisdom. It's cumulative experience. And that is the fact that just, having gone through something multiple times, you gain the experience of how best to deal with that issue compared to maybe the first time that you went through it.
And it looks like we have a question from the web.
This question comes from Joanne Caldy. What role do you see geriatricians and long-term care practitioners playing in addressing cognitive aging with patients and families, especially those in nursing homes? What are some key messages they should be sharing both with patients and the families and nursing home staff?
Well, as probably most people recognize, many individuals in nursing homes are suffering from Alzheimer's disease or other significant neuropathological processes, and that's one of the reasons they're in nursing homes. I think what sometimes is forgotten is that there are people in nursing homes who are not there for Alzheimer's disease, they're there for other reasons, physical problems that prevent them from being able to interact effectively. I think it's tempting for primary care physicians, family physicians, for people who are medical directors and others who are attending in nursing homes, to kind of want to divide them into two categories. This person has real problems, and this one has no problems, and therefore I don't need to worry about it. I think that conversation about how you're doing with your cognition, as we've talked before, I think an understanding by these individuals, it's not just Alzheimer's disease, you're talking about a spectrum, and you need to be aware of that, and you need to be attentive to it with your patients, is absolutely critical in providing optimal care to persons in a nursing home.
I would just add that I think a lot of the recommendations and the opportunities for action would apply to a nursing home setting. So I think we see this report certainly as being very important for that demographic and the healthcare professionals associated with that.
Part of the question, I think, was also about geriatricians in general. And one of the things that we emphasized in the report was the importance of the wellness visit and the importance of having the physician at the annual evaluation of a patient bring up the topic of cognitive health and cognitive aging. And that's why we talked about examining the medications that people are taking, asking them about their lifestyle. Are they maintaining an active lifestyle? Are they treating cardiovascular risks? So there's a central role for geriatricians in this aspect of the report.
Hello, Cheryl Washington with the National Center for State Courts. And on your slide, I saw you had NHTSA mentioned as it relates to driving and getting your license renewed. And I just wanted to point out that the Consumer Financial Protection Bureau is doing a lot of work as it relates to financial abuse of older people, and they may be a group you may want to partner with. But in terms of training medical professionals, be they nurses or physicians, do you think we are preparing for the silver tsunami that is getting ready to occur, and specifically as it relates to maintaining brain health and the community connections that are important and the continual learning that's important to just keep the brain sharp?
I guess a two-word answer to your question is amen and no. Let me explain that. So amen to the fact that we are well aware and we document that there are some agencies, especially in the financial institutions, that are really beginning to take this on and take it on seriously. And we commend that. We think that needs to be much more widespread, and people need to be doing more of that. I think in terms of the no, the awareness overall, I think we recognize is pretty limited. And so until this really becomes just so obvious to everyone, and often after something pretty significant has happened that could be especially damaging to the older person, being in an automobile accident that perhaps could have been prevented, or actually losing a fair amount of money through fraud that perhaps could have stopped if some brakes had been put on the process of a financial transaction. Much more needs to be done, but we're very aware and we applaud the things that actually have been done.
I would just add that I don't think we're, as a society, prepared enough for the silver tsunami. On the other hand, I think we're getting there, and I think this report, again, emphasizes some opportunities for action. I think we need to bring cognitive aging to the forefront, because I don't think it always is in the forefront. I think people have a much better understanding of aging of other parts of the body, but less so about the brain. So I think there's a lot of opportunity. As Dr. Blaze mentioned, many individuals want to maintain being sharp. It's one of their main concerns. And so I think we can work with that real interest and educate both families and patients, individuals, and also healthcare professionals, because I think there's a lot of need for that. And these are really some of our recommendations.
Any other questions?
So Matthew Baumgart again with the Alzheimer's Association. So I want to get to your recommendations to individuals to reduce your risk of cognitive decline, because I want to ask about one specific one. Last summer, the World Dementia Council asked the Alzheimer's Association to assess the current state of the evidence and come up with recommendations on what can be said about the risks of cognitive decline as well as the risk for dementia. And on the cognitive decline side, I feel very good because we came up with almost exactly the same recommendation that you did, which was be physically active and to reduce risk of cardiovascular risk factors, hypertension, smoking, and diabetes. The one we had in there that you did not, which I'd like you to address, is midlife obesity. And I know that's been complicated perhaps by the large study that came out of the UK last week, but I'm wondering if you could address where you see the evidence on midlife obesity.
So I'm going to turn this over to my colleagues to say, but I will make a comment initially, and that is we considered obesity as one of the potential risk factors, and we thought that the level of evidence for obesity itself and the threshold for us in terms of level of evidence was not necessarily a correlation within a population. It was more if you actually reduce obesity, does that lead to improved cognition? And those studies are much less supportive of what we feel we can say about the importance of obesity in terms of if you actually get in. And we were very interested in action. What could you do if you've got a risk factor? If you actually reduce that risk factor, does it make a difference? And in this case, we did not feel obesity actually reached that threshold.
Yes, and I would just say that when we talk about the opportunity to reduce or better control cardiovascular disease risk factors, I do think that there's some other ones in there that are linked. I mean, we don't know exactly what the mechanism might be that midlife obesity might increase risk of cognitive impairment, but one of them certainly is by cardiovascular pathways. So I think I think it was there were other things encompassed in the maintaining cardiovascular disease health.
And we have a question from the web.
This comes from Kim Johnson. Did you come across any communities or countries that are taking the initiative to address cognitive aging among their population?
We did not talk about that. So I really can't say anything more than we were not aware of that, and we did not talk about that specifically. That may be out there, we just were not aware of it. If somebody knows of something, we would love to know that. I just don't know.
I think consumers would be very interested in some of your recommendations around diet. Could you talk a little bit about that?
So this is an area of great interest, and do certain types of diets actually lead to improvement? So I think our bottom line on diet is that if you kind of look at the different diets overall in terms of their ability, the ability of going on that diet to improve cognition, the evidence is weak to moderate. There's somewhat stronger evidence with the DASH diet and with the Mediterranean diet. And so that's there. But there also, even with the Mediterranean and the DASH diet, there are mixed results from the studies. Now, I think that for a lot of other reasons, it makes a lot of sense to go on a diet such as this, reducing cardiovascular disease, reducing hypertension, et cetera. These diets have been pretty well demonstrated to be effective in those particular situations. But again, our focus was specifically on cognition, and the evidence was mixed. But if there is any positive evidence, it relates to the DASH diet and the Mediterranean diet.
Are there any more questions? Okay. With that, then, I'd like to conclude our public briefing. Thank you all again for coming out here, and also for those joining via the web. And one more reminder, you can download the report as well as the materials on this website, www.iom.edu/cognitive aging. Thank you all.